Good afternoon, everybody. Doc Dave here on Call with Doc Dave. And I've got episode number 36. Very interesting, very important episode on calcium buildup in the coronary arteries. This is going to be good because this tells you everything to know about why and how you have a heart attack. So this is something you're going to want to really pay attention to, maybe listen to it again. I'm going to try to keep it simplified so you understand what we're talking about. Not a lot of doctors speak here, but informative, educational information. And this is the kind of episode you want to pass on to your friends and family because everybody really needs to know about this. So, calcium buildup in the coronary arteries. Okay, it develops due to the following conditions. Okay, number one, atherosclerosis. Now, you may have heard this, but if you haven't, the layman's term is hardening of the arteries. And what does this mean? How do the arteries harden? Because the arteries are generally pretty pliable, expand, contract. As your pressure goes up, goes down, you get dehydrated, they contract, you get volume overload or high blood pressure, they tend to expand. So, atherosclerosis is due to a plaque buildup secondary to LDL cholesterol, low density cholesterol. Now, you can go back to one of my prior episodes on cholesterol, which is actually my most listened to episode so far, and by far, about cholesterol. Breaks it down to the LDLs, HDLs, and stuff. But all you need to know for now is that it is a buildup of the low-density cholesterol. It accumulates in the coronary artery walls. So it builds up in the walls. It makes the walls stiffer, makes them harder and less pliable. And the most common cause of coronary artery calcification is the plaque hardness. So what basically happens here is that the LDL cholesterol builds up in the coronary artery wall, and it builds up with irregularities to it. It doesn't have a smooth transitional wall that the blood just flows through, but is narrow. No, it has little peaks and valleys, and you look at it under a microscope, it'll almost look like a horn or porcupine, needles. So what happens is, as this plaque builds up in the coronary artery wall, not only does it make it hard and stiff, but the platelets coming through with the blood in your blood flow are little things called platelets, and they're generally there like you cut your finger, you get a laceration or something, it goes in and it heals up the wound so you just don't bleed to death from a little cut on your finger. These platelet accumulations are pretty friable. They're not really hard, and they just, they're sitting on the top of one of these spiny protrusions from the hardening of the wall, the coronary plaque, and as the blood continues to flow through, the platelets will break off. They accumulate, and then all of a sudden, boom, the pressure from the blood breaks it off, and it flows down the coronary artery to a point where it can no longer go any further as the artery narrows, as it gets further distal, and it blocks the artery. Boom. Big clot, big blockage, all the other platelets coming down back up against it, and eventually shuts it down from maybe 10% to up to 100%. And when that happens, all of the myocardium, which is your heart muscle wall, distal to that clot will die off because it doesn't have any blood flow anymore. So it's that simple. And when that dies off, you get chest pain and you get a heart attack. So that's basically how it works. Low density cholesterol, hardening of the arteries, plaque buildup, and platelet accumulations, platelets breaking off, going distal, clots off the artery, kills the muscle wall, heart attack. So there you go. That's it in a nutshell how heart attacks work. Now, this is why your doctor will tell you proactively, preventively, when you're kind of like over 65, to take a baby aspirin. Because what the baby aspirins do is they don't get rid of the plaque on the wall, but they prevent the platelets from building up and clotting and breaking off and going down distal. So they keep the platelets flowing evenly and just going down and doing their normal job and not getting stuck on the protrusions from the plaque wall. So baby aspirin, 81 milligrams, that's all you need. You don't need 2 of them, you don't need 3 of them. If you have an acute heart attack, then the paramedics will give you what's called a 324, which is a 4 times the 81 milligram baby aspirin, because you really want to break that plaque up and keep it moving down and break it into smaller pieces so it doesn't clot and block the artery and kill off any more of the myocardium until you can get to the emergency room and then eventually into the cath lab and get a stent or a bypass graft. So that's what the baby aspirins are for, and that's what the mega aspirin is for. So, but you don't take mega aspirin on a regular day. You don't take 324 every day, otherwise you're going to have a bleeding ulcer in your stomach very shortly. So 81's enough. That's all you need. So that's kind of how a heart attack occurs. And other things that cause damage to the coronary artery wall, it's not just the cholesterol plaque, but it's hypertension, high blood pressure. The pressure can damage the wall and make them more susceptible to plaque buildup. And then again, you go through the whole cycle with the platelets. Number 3, diabetes mellitus, same thing. If you're diabetic, that damages blood vessels. And, it doesn't select blood vessels. It can damage the coronary arteries as well as any other blood vessels in your body. Number 4, smoking damages blood vessels, increases the risk of atherosclerosis. Number 5, obesity. It contributes to high LDL cholesterols and therefore hardening of the arteries. Number 6, family history increases risks, but that's usually only up until you're about 70. If you get past 70, family history isn't as important anymore. All these other things start to become more important. If you're smoking, you got high blood pressure, diabetes, you're obese, whatever. But if you're in your 50s and you've had your parent die at 50 and maybe a sibling die at 55, then you're at a higher risk of having a heart attack. So you got to prevent all this stuff. And if you have the high blood pressure, diabetes, you got to take your medications and treat it. If you smoke, you got to stop that. You got to exercise, you got to lose weight, get on healthy diets. Number 7, age alone. By the time you're 80, you're going to have calcium in your coronary arteries. You're going to have hardening of the arteries. You're going to have a little high blood pressure. You're going to have maybe, adult onset diabetes. But you could treat all these things. And the last thing, which is kind of rare, is chronic renal failure causes, artery disease as well as chronic inflammation. Okay. The consequences of calcification in your coronary arteries. First of all, it narrows the arteries because now the artery is, instead of having a normal, complete flow through the artery, it's getting narrower. And as it gets narrower, makes your blood pressure go up and makes these calcifications occur. So that's kind of, and then you obviously get chest pain, angina as it narrows and builds up, and then eventually have a heart attack. Okay, so how do you detect this? This is really interesting. This is a good part of the lecture here. Detection, calcium scans, coronary artery calcium scans. You can get these things done at Walmart almost nowadays. I mean, they don't need a medical ER or coronary artery or coronary cardiac suite in a surgery center. I'm being a little bit, liberal with getting it done at Walmart, but you can get them done as an outpatient. There's outpatient services that, it's just a scan. So it's not an invasive procedure. You don't have to have a doctor or a nurse there. You can have a, radiology tech. It's like getting a CT scan or getting an MRI scan. There's outpatient centers. You go and get this done. And usually there's not a physician or a nurse even at these places because it's non-invasive. You just got like going and getting an x-ray somewhere. So these are really important. And they have a score that comes out of these scans. You get a calcium score. And the scores will determine, what your risk of heart disease is. So let's go over the score. If you get a 0 score, you got no plaque. Boom, good for you. If you get a 1 to 10 score, it's a small amount of 10% chance of an MI. Well, you can have a 10% chance of getting hit by a car going across the street. So if you're 0 to 10, you're generally in good shape as well. Now, when you get into 11 to 100, then you're into mild heart disease, mild chance of having an MI. So, you got to be aware of it. You're not in a danger zone yet. You take care of yourself, you exercise, do a good diet, take your medications that you're supposed to be taking, you're going to be in good shape. However, then it jumps up to 100 to 400. I don't know why it doesn't go in smaller increments, but 100 to 200, 200 to 300, but you can kind of figure it out yourself. As you get higher in the score, the worse your condition can be. So the 100 to 400 is a moderate amount of plaque and a moderate high chance of having a heart attack. Then if you're over 400, you got issues, you got problems. You have a 90% plaque blocking the coronary arteries with a high chance of an MI. So if you got over a 400, say you're 500 or 600, I don't mean 410, but you're high enough. Your doctor needs to be notified, and he needs to have a cardiologist evaluate you, and a cardiologist may recommend a proactive preventative where they do the cardiac intervention, squirt some dye in you, and they look at your coronary arteries, and if they see they really are blocked up while they're in there, they can do the stent. Or if they need to, they can do a CABG, a coronary artery bypass graft, where they take a graft like from your lower leg or whatever, and they just graft a new coronary artery into you. So, these are things that you work out with your doctor and with your referral to your cardiologist. And like I say, you're going to the cath lab and you're getting the cath. Now, how do you treat this? How do you treat it? Not your doctor or cardiologist, but how do you treat it? Well, number one is lifestyle changes. You got to have decreased high saturated trans fat diet. You got to eliminate processed meats. You got to eliminate fried foods, butter and cream. The best food for this is the omega-3s, antioxidant. Salmon is the best. Salmon's number one. It's got loaded with antioxidants and omega-3s. So that's your healthy diet. Number two, regular exercise, at least 20 minutes a day. Walk a mile, walk your dog, get on your treadmill, go walk to the grocery store, walk up a flight of stairs instead of taking the elevator. These things all really help. Next is stop smoking. Absolutely. I don't have to go into that. We've done complete episodes on smoking. And the last one is weight management. Give your body do a favor for your body, lose some weight, and it'll make your heart much more efficient. Number two is medications. Okay, so your doctor may recommend a statin, especially if your LDL is high. And the statin, what it does is it decreases the production of cholesterol in the liver, and it helps process the elimination of cholesterol. So statins are important if your cholesterol and LDL are high. If they're not high, then you need to discuss this with your doctor, because there's side effects with every medicine, and there are side effects with statins as well. So that's something that you guys will make a decision on. Other ones are your normal medications that you take for your diabetes if you have it, normal medication you would take for your hypertension if you have it. You have to control these comorbidities. Otherwise, your heart's going to continue to be strained, and this hardening of the arteries and plaques are going to continue to develop. And the most important medicine, even if your cholesterol is normal, your doc says, well, you really don't need cholesterol because of the risk benefits. You don't need the statin, I should say, is baby aspirin. Because what the baby aspirin does is it dilutes out the platelets as they go past these hardening of the arteries and these plaques in your artery. It doesn't get rid of the plaque. It just decreases the platelets so that you don't get the accumulation in the clumps, and therefore you don't break off and go distal and cause an obstruction in the coronary artery and therefore have a heart attack. So this is really important that you control this platelet buildup by taking a baby aspirin. That's it, just an 81 milligram. Generally no side effects. I mean, if you got a sensitive stomach, you might get burning in the stomach. If you got a real sensitive stomach, you may get a little bleeding in the stomach, but everything has a risk benefit to it. And then an anticoagulant, if your calcium is really high, your calcium score is in the 500s or whatever, they may actually put you on an anticoagulant instead of the aspirin, not together, and that will thin out your blood as well and thin out your platelets to some degree. Number 3 is what type of procedures, surgical procedures can be performed for this. Well, number 1 is an angioplasty with the stent. Like I say, you go to the cath lab, you get a cath done. They see how obstructed your calcium is, and if it's significant enough, they're already in there, they just throw a stent or 2 in there, and that reopens the closing of the arteries. And the stents will actually compress the plaque and flatten it out and open up the flow of the artery distal. That's what the stents do. They increase the artery diameter and allow the blood to flow down distal. It's like they even have balloon compressions where they can put a balloon in and inflate it, and that will compress the plaque as well. And then there's the old-fashioned cabbage, where they actually open you up through your sternum and put a vein from another source in your body, usually your lower leg, and transplant that to your coronary artery. There's also other stuff nowadays. They got atherosclerectomies, they got intravascular lithotripsy, where it's kind of like you get a kidney stone. They blow up and break up the plaque into very small pieces, and it goes down so far distal that the little bit of clotting that you're going to get at the end isn't going to be significant. So there you go. There's your coronary calcifications and MI. I hope this was, educational for you and interesting, which I think it should be, both. This is something you definitely want to pass on and share with your friends and family. And so if you like this, not only hit the like button, hit the subscribe button, because I got a lot more good episodes coming down. And I hope, this will educate you on what you need to know about having heart attacks. So thank you for your time, and I will talk to you soon. Doc Dave signing out. Remember, I'm your friend, not your doctor.